When we get older, we suffer from many dangerous diseases, and one of the extremely dangerous diseases that the elderly often develop is prostate cancer. Hello, my name is Dr. Robert Williams. I am a urologist and one of the top kidney specialists in the United States. Today, I want to share a very important story about prostate cancer, a dangerous disease that men can develop, especially in older men. Fortunately, although it is a serious disease, it can be effectively controlled if detected early. According to the American Cancer Society, this is the second most common cancer in men after skin cancer, according to reputable statistics from the U.S. Health Organization, in 2024 alone, about 300,000 American men were diagnosed with prostate cancer for the first time, and more than 30,000 men died from this disease. But there is still hope. When detected early, prostate cancer is less likely to be fatal. That is why understanding its early warning signs is so important. In today's video, with my 20 years of experience, I will thoroughly explain prostate cancer. I will explain what prostate cancer is, the 10 early warning signs of this dangerous disease, its causes, and finally provide ways to prevent prostate cancer. If you like this video, please give the Senior Health channel a thumbs up and follow the channel so you don't miss any videos about health for the elderly. Now, let's get started. Understanding the prostate and its role. The prostate is a small gland located just below the bladder and in front of the rectum. Its main function is to produce semen, a substance necessary for transporting sperm during ejaculation. Although the prostate is small, its health is very important for your overall well-being and reproductive system. Most prostate cancers begin as adenocarcinomas, meaning they develop from the glandular cells in the prostate. Generally, there are two types of prostate cancer. Aggressive cancers that develop quickly, can spread rapidly, and are more dangerous. Slow-growing cancers that may go undetected for many years without causing noticeable symptoms. Some men may live for decades with slow-growing prostate cancer without ever experiencing any symptoms. However, the risk increases if the cancer spreads outside the prostate. This is why early detection and regular screening are so important. Sign number 1, problems urinating. One of the first signs to look out for is difficulty with urination. Many men notice that they struggle to start or maintain a steady stream of urine. Prostate cancer can lead to urinary retention, where the tumor or an enlarged prostate obstructs the flow of urine. This is often the first sign that something is not quite right. If you find it increasingly difficult to empty your bladder, it's important to consult your doctor as soon as possible. Sign number 2, painful or burning urination. Another early warning sign is the sensation of pain or burning during urination. As the prostate enlarges due to cancer, it can put pressure on the urethra, leading to discomfort and a burning sensation when you pee. In some cases, the cancer may also invade nearby tissues such as the urethra, bladder, or rectum, intensifying the pain. Although infections caused by urine retention might offer temporary relief with antibiotics, persistent pain is a signal to seek professional advice. Sign number 3, frequent nocturia. Frequent nighttime urination, known as nocturias, a symptom that should not be overlooked. If you find yourself waking up multiple times during the night just to use the bathroom, this can disrupt your sleep and leave you feeling exhausted throughout the day. Nocturia may be more than just an inconvenience. It can be an early indicator of prostate cancer. Keeping a diary of your nighttime bathroom visits can help your doctor determine whether further tests are necessary. Sign number 4, blood in the urine. Seeing blood in your urine, a condition known as hematuria, is understandably alarming. Hematuria can occur in two forms: microscopic hematuria, where blood is only detected under a microscope, and macroscopic hematuria, where blood is visible to the naked eye. Approximately 3 to 5% of men with prostate cancer might notice red or pinkish blood in their urine. This symptom is often associated with advanced stages of the disease, when the cancer has begun to invade the urinary system. If you observe any blood in your urine, you must undergo a comprehensive examination without delay. Sign number 5, loss of bladder control. A less common but significant sign is the loss of bladder control or urinary incontinence. This can occur as a direct consequence of the cancer or as a side effect of treatments like radiation therapy or prostate surgery. The prostate plays a crucial role in controlling the flow of urine, so any interference, whether from the cancer itself or from its treatment, can lead to problems with bladder control. If you experience any changes in your ability to hold urine, consult your healthcare provider promptly. Sign number 6, pain while sitting. If you often feel discomfort when sitting, especially on hard surfaces, this might be another indicator of prostate cancer. An enlarged prostate can cause pain and numbness in the perineal area, the region between the genitals and the anus. This symptom might seem minor at first, but persistent pain while sitting should be evaluated by a professional. It is another piece of the puzzle when it comes to early detection. Sign number 7, pain in the rectum. Pain or discomfort in the rectal area is another warning sign, particularly if it is accompanied by changes in bowel habits. Prostate cancer that spreads to the rectum can cause pain, constipation, incontinence, gas, partial bowel blockage, or even diarrhea. These symptoms should not be dismissed as merely digestive issues. A thorough examination, including digital rectal exams and possibly ultrasounds, can help pinpoint the cause of these symptoms. Sign number 8, pain in the back, hips, or legs. Persistent pain in the lower back, hips, or legs is often a sign that the cancer has begun to spread to the bones. Prostate cancer has a tendency to metastasize to the skeletal system, causing deep aching pain in these areas. Studies have shown that men experiencing unexplained back or hip pain have a higher likelihood of being diagnosed with prostate cancer. If this type of pain arises without an obvious cause, it is essential to seek medical advice immediately. Sign number 9, painful ejaculation. Experiencing pain during ejaculation is not something to ignore. Whether the pain is a sharp sensation, a dull ache, or a persistent discomfort, it could be a sign of deeper prostate issues. This symptom can affect your overall sexual health and quality of life. Any persistent discomfort during or after ejaculation should be discussed with your doctor, as early intervention can prevent further complications. Sign number 10, sudden, unexplained weight loss. Finally, one of the more systemic signs of prostate cancer is sudden, unexplained weight loss. If you find that you are losing weight despite no changes in your diet or exercise routine, it could be a red flag. Cancer cells consume a significant amount of energy and disrupt normal metabolic processes, leading to symptoms like fatigue, loss of appetite, and nausea. This type of weight loss is a signal that your body may be fighting a serious illness, and it should prompt immediate medical evaluation. What causes prostate cancer? Despite extensive research, the exact cause of prostate cancer remains unclear. Like many cancers, It begins when cells in the prostate start to divide more rapidly than normal. In a healthy body, cells grow, divide, and eventually die in a controlled manner. However, in prostate cancer, this natural cycle is disrupted. Abnormal cells accumulate and form a tumor. Over time, parts of this tumor can break off and spread to other parts of the body, a process known as metastasis. The reassuring news is that many cases of prostate cancer grow very slowly. In many instances, doctors can detect the tumor before it spreads beyond the prostate. When prostate cancer is caught early, a wide range of treatment options is available, significantly increasing the chances of a successful outcome. Risk factors for prostate cancer. Understanding your risk factors can help you take proactive steps to protect your health. Here are some of the key risk factors associated with prostate cancer. Age. The likelihood of developing prostate cancer increases as you age, and it is most commonly diagnosed in men over 50. Family history. If a close family member has had prostate cancer, your risk of developing the disease is 2 to 3 times higher. Obesity. Being overweight or obese may increase the risk of developing aggressive forms of prostate cancer and may also raise the likelihood of recurrence after treatment. Ethnicity. African American men are at a higher risk of developing prostate cancer, with statistics showing that 1 in 6 African American men will be diagnosed with the disease in their lifetime. How to prevent prostate cancer. While there is no surefire way to prevent prostate cancer, there are several measures you can take to reduce your risk and improve early detection. Healthy diet. Focus on a balanced diet rich in fruits, vegetables, and whole grains. Eating a variety of nutrient-dense foods can support your overall health and may help lower the risk of certain cancers. Regular exercise. Engaging in physical activity for at least 3 days a week can help maintain your overall health, support weight loss, and potentially reduce your risk of cancer. Maintain a healthy weight. If you are overweight, consider gradual weight loss through a combination of diet and exercise. Maintaining a healthy weight is one of the most effective ways to reduce your cancer risk. Discuss risks with your doctor. Regular checkups and honest discussions about your family history and other risk factors are key. Your doctor may suggest additional screening tests or preventive medications such as finasteride or dutasteride after, carefully considering any potential side effects. Thank you for joining me today. I invite you to leave your thoughts or questions in the comments below. Your health is invaluable, and together we can beat prostate cancer by catching it early and taking the right steps toward treatment. Stay safe, stay healthy, and remember, the journey to a longer, active life starts with a single checkup.